Hi, I'm Dr. Scholz. Let's talk about prostate cancer. Today we're going to cover the topic of active surveillance for men with prostate cancer. Active surveillance is a process of ongoing monitoring for men who harbor very low-grade cancers in the prostate. An essential ingredient of active surveillance is accurate staging. Men need to be confident that the type of cancer they have is indeed the low-grade form that won't spread. To ensure this is the case, staging with biopsies, imaging, and blood tests is essential to make sure there's no higher grade disease lurking in a corner of the prostate that's been missed. Postponing treatment of something called cancer is certainly counterintuitive. Why are so many men deciding to do active surveillance? Well, first, bottom line, the treatment is clearly worse than the disease. Men can experience immediate incontinence, erectile dysfunction, and other complications with treatment. This can all be avoided if they postpone treatment. This certainly is one of the attractive aspects and one of the reasons why men are doing active surveillance. Another attractive aspect of active surveillance is our realization that overall medical technology is moving forward very, very quickly. Every year that people postpone treatment, they grandfather into newer and better treatment. Another attractive thing about why men are doing active surveillance is that the technology for monitoring gets better every year too. It gets safer and safer to do active surveillance since we have better imaging, better genetic technology, and just a plain better understanding of what prostate cancer is and how it behaves. What exactly is the monitoring process? Unfortunately, for many years, we didn't have adequate imaging that was accurate enough to rely on 100%. To be safe, therefore, men had to have repeated biopsies every 1 to 3 years, depending on different factors. Fortunately, imaging technology has advanced tremendously in the last 2 to 4 years, and we now have several studies proving that 3T multiparametric MRI is more accurate than a biopsy. It's also non-invasive. This is really good news for men, considering that the complications of random biopsy can include sepsis, erectile dysfunction, pain, and bleeding. Many men are now adopting an approach of MRIs annually rather than doing periodic biopsies. If MRIs are stable over time, and the assumption is these MRIs are done at a center of excellence, there's no need for routine biopsies. Another basic component of active surveillance is, of course, doing PSA testing every 3 to 6 months. Men have to be careful, though, because we know that PSAs can bounce around quite a bit, and a simple rise in PSA may not signal an advance in the cancer. But PSAs are indeed done sort of like a backstop, a way to cross-check and make sure something's not being missed. And the typical PSA has to be interpreted in light of how large the prostate is. Men with big prostates are going to run higher PSAs, and with small prostates are going to run lower PSAs. So the monitoring process for active surveillance, therefore, would consist of a PSA every 3 to 6 months. Men that have been doing this for several years can usually graduate to every 6 months. Initially, when we're not quite certain, we'll start off with every 3 months. And then ongoing imaging with MRI every year. And after a number of years, some men may be able to graduate to every other year. Who exactly is eligible for active surveillance? The standard has been evolving over the last 10 years. When active surveillance first came on the scene, all men had to have very small amounts of grade 6. Those people did so well that the doctors started to expand the cohort to include just about any amount of grade 6. Now, more recently, studies are suggesting that men that have small amounts of a subtype of grade 7, that's 3 plus 4, not 4 plus 3, are also eligible for active surveillance. The belief presently is that the percentage of grade 4 in the biopsy should be under 10 to 20%. Apart from the biopsy results, the typical PSA threshold, upper limit is around 10. However, some men have incredibly large prostates, and they may be running a PSA of 10 simply from BPH. We shouldn't exclude those people simply on the basis of raw one-size-fits-all PSA cutoff. So overall, present thinking is that just about anyone with grade 3 plus 3 equals 6 and select patients with 3 plus 4 are eligible to do active surveillance. Why is active surveillance still controversial? It's estimated that half of the men diagnosed every year with grade 6 still proceed on and have immediate radical therapy. I think it's quite understandable, given that this low-grade, harmless process is still called cancer. That word is so powerful and emotionally charged. Many people cannot get past the fact that this type of cancer, and we put cancer in quotes, is really harmless. The other problem, of course, is that the surgeons and radiation therapists that are monitoring and supervising these men are really trained in treating prostate cancer. They're also a little nervous because even if one case sneaks by and someone gets a cancer that spreads, they're going to feel terribly responsible and also have a concern about getting a medical malpractice suit on their hands. So many of the physicians are rather half-hearted about the active surveillance process. If you decide to do active surveillance, you need to be aware that your physician may not be totally bought into the idea. That does not mean that active surveillance is unsafe. The underlying science is extremely strong. It just means that this is a new type of technology and that the system is still getting used to the idea. Today, we've given you a very brief introduction to the field of active surveillance. If you want to learn more, go to our website at pcri.org and subscribe to our channel.